conversation as we're looking into why research matters and how hospitals turn questions into the better care. And that is Dr. Ronald Kasoma Mutebi from the Department of the Public Health and Research at Mengo Hospital. And we need to find out more of the information as he unpacks for us most of the information you need to know. Good morning, Doctor, and happy to see you on this program.
Yeah, thank you very much. Good to have me here. Thank you for hosting me. I'm Ronald Kasoma Mutebi. I'm a doctor originally.
Okay.
Yes, I have my master's in epidemiology and biostatistics. In simple terms, disease surveillance.
Okay.
I'm a research scientist.
Okay.
I'm in Mengo Hospital, and I'm affiliated to other different institutions like Makerere University, School of Public Health, and Makerere Lung Institute. So what brings me here today is to tell the world why research matters and how hospitals actually improve through research, and what role patients have in this research and improvement of quality in health. Basically, that is a brief introduction of who I am. Yes, maybe going forward, there's some key things we need to ask ourselves. The questions in research we need to ask. Why does research matter? But first of all, probably let us first begin with what research is.
What research
in simple terms. To a lay person, research is those other questions that need to be answered in simple terms. So research can be defined at different levels, to an individual, to a hospital, to a community, to a nation, and to the world at large. To an individual, this question comes as, why am I feeling this way? And then we need to find out why this person is feeling this way. So then to the hospital, why are patients presenting in a given way? If probably have different symptoms that are coming in a number of patients. As an institution like Mengo Hospital, we need to ask ourselves, why is this disease happening this way? So that is disease pattern. To a community, we could ask ourselves, why are people of this disease coming from this one community? And then to the nation, why is it that maybe this nation is having this kind of disease, and how can we actually tackle the problem? So in simple terms, research, it's like information to yield evidence in order to solve these important questions. So in simple terms, that is research. Why does it matter? At the end of the day, we want to improve quality of care in institutions. And institutions come from as low as the village health teams, the lowest level of health care, village health teams, the health centers, to actually tertiary and then national hospitals. The information we get from patients actually helps us to get better solutions. Some are local solutions, but all these solutions come from what we have collected from patients. This information is key to actually all of us, to us the researchers, to the patient, to the institutions, and also to the community, and lastly to the whole nation at large. Yes.
Okay, you mentioned about the research matter in simple terms, and why does it matter in the healthcare?
In the healthcare, let's go back to the definition of research. Research begins as a problem or as a question. Why is this happening in this community? Then after that, we need to design a solution. But remember, these solutions are designed based on evidence. So from that evidence, we come up with these solutions. What am I trying to drive at? At the end of the day, we are trying to improve quality of care. This quality doesn't only go to the institution, but also to the patient. We come up with different innovations. At large, after having different solutions, these can be scaled up from first the institution as Mengo Hospital, then to district as Kampala, then lastly to the nation. So we design health policies from this research. That is why actually it matters. You to the patient or to the person, the viewer, how is it going to be important to you? When you give us this kind of information, collectively we are going to design all the possible solutions in order to make your care safer, faster, smarter, and easier. So at the end of the day, we are trying to improve services to this person we are giving our care to. So in Mengo Hospital, to our side, where it matters, at the end of the day, we want to make this person feel better. We want them to come more to hospital, because we are doing everything possible to make their lives simpler, safer, and we're giving them quicker and smarter services. Yes.
And for how long does it take for you people to really make a research about the disease? And have you erred in a certain way, or it comes out with clear results that this is that?
Research is a continuous process. When we look at how health has evolved, how the world has evolved, it is after these so many questions people have been raising, how the vaccine came into play. When I was studying epidemiology, how people got the discovery of cholera. Cholera was coming from a well, and over time people noticed that actually people were dying from what? From a given disease that they didn't know about. But it was because people used to, the toilets used to be very close to the water body, and people were drawing the same water close to the toilet. So at the end of the day, we learned that over time, probably the water was the cause of what? The disease was. At the end of the day, that is how actual research evolved. So in terms of how long, it's very hard to tell, because research has a process. It has to go through a series of processes. Maybe the other example I can give is how drugs come into play. How do we get the antibiotics? They follow a given chain of series to deem the drug safe and actually efficacious and actually eventually effective for a given community. So it is a process. We do not have a defined time period of from the question to the findings to the implementation. They vary according to what actually trying to discover.
Okay. So should we say some reason as why, remember the COVID-19, when it was on the rise in this country and also other parts of the world, that people tried to find out which a vaccine is able to treat this COVID, whereby the majority maybe failed, and maybe some Ugandans tried to make some research and they come up with some traditional maybe herbal medicines. They believe that they will just heal this thing. So why were you people within that period of time, in that period, what was the main cause or maybe the main problem? Do you find difficulties while carrying out some researches on some viruses or some diseases? And how is it?
So when we go back to the COVID era, why we had a lot of desperation? It was because this was a new thing, a new thing, and it was actually rapidly infecting different people. So because of the desperate measures, people came up with all modalities of how they can avert the challenge. So at the end of the day, different teams came to play a role to see how they can actually stop the death and actually the infection to the disease. That is why we had different solutions. One of them, let us stop the movement of people. The other was, let us use masks, hand washing, maintain hygiene. If someone is infected, let us actually isolate them. All this is done because they're trying to find a possible solution that is actually research evolved. So at the end of the day, they came up with another modality, the final one. Let us come up with a vaccine. But the reason as to why actually we had challenges and so many contemplations about the vaccine, it is because the vaccine had a very short time period of development, because it has to undergo through a series of so many processes. That is why there are so many contestations. Will this vaccine work? Yes, they had those challenges. So, but that is actually a classical example of COVID, of how people are desperate for answers. Now that is research. People become desperate for answers. And our role as healthcare providers is to provide important solutions to those problems. How can we answer those problems? How did we have to avert COVID? Much as it was a virus, we needed to come up with solutions that not so many people keep dying because of COVID. And indeed, the lockdown had a great impact. I'll say so. Because people were not moving. So there was no transmission from one person to another, because there were no clear movements. And I think the president did a good job.
Yeah.
Yes.
Initially, well, how about when look at the repetition of the disease, whereby I think we have seen so many researchers trying to make a research about a certain virus. Maybe they may think this could be the solution to this so that it can be stopped, but we find the thing again happening over and over again.
Yeah.
So how do you cope up with that?
Like I said, research is evolving. Research is not a one time.
It does not stop. It's
doesn't
continuously.
stop.
Okay.
There's a reason as to why. Okay, let me just step away from health. The kind of the clothing we put on today has evolved over time, from back cloth to right now the refined cloth. What does it mean? Even in health, the drugs keep changing. The diseases keep changing. We have what we call mutations in diseases. So we could have a virus that keeps actually evolving. You bring up this, the drug actually evolves. So that shouldn't stop us from what? From working. Like I said, research is a continuous process. So we keep working on whatever modality to make sure we avert this problem. That is why right now they're trying to get a vaccine for HIV. Though HIV has different mutations, it keeps changing. Yes.
This brings me to another question. Where do you get this information from? But I believe there are so many people who have tried to come up with research about certain, when it comes to the health sector. And where do people get the information from? Someone will have to ask themselves a question, because we read and see the research people have presented unto us, maybe about a certain thing, but someone will ask themselves a question: where do they get this information from? Yes, and you conclude that this research we have made is going to resolve maybe the think of HIV/AIDS, which has been on the rise, and I think it has been coming in this, and that's how it can be stopped, maybe like that. Where do you get that information from?
The information is from patients.
From the patients themselves.
From the patients. You know, at the home of research, we are trying to design a solution to this problem, and the problem came from the patient. It is very important for this patient to tell us what is happening, and we have like an aggregation of so many patients saying the same thing. That is actually information, and very usable information to us. So that is where actually our research question is. Why is it that maybe these 2,000 people are reporting the same thing?
The same thing, yes.
That is where we start designing solutions from. So we do research from patients. Patients actually are very, very key, including myself. I'm a participant in research. You are a participant in research. So at the end of the day, this information you give us, we make it usable. We make it important. We don't just tell us and we leave it the patient. We leave the information in the systems. We use the information. But let me put this a little bit clear and straight. If the research we use, the information we use is anonymized. We can scrape it off the name, off the details that can actually identify this person, and we use it as an aggregated data set that actually we use later, and we find solutions to whatever problem that actually trying to look into.
Interesting.
Yes.
And how is it important for the Mengo Hospital and its patients?
Actually very usable. Let me give you a classical example. I think that was in 2023. We have a set of engineers in Mengo Hospital. There is, I'll call it a device that was actually modified, and we came up with a circuit, what we call a CPAP generator. We realized children needed low pressure oxygen, not like highly pressurized oxygen. The children need very low, because one, they are little, and we need this constant pressure of oxygen going into their nostrils, into their noses. We came up with a device, a circuit. This circuit actually has helped us to improve care. There's also a paper from Mengo Hospital. The authors, Dr. Edith Namlema, Dr. Rhoda Maega, with collaboration from Leeds University. This innovation has actually helped us actually in our low resource setting, and this can actually be used in other institutions where these machines, what they call the CPAP machines, cannot be actually affordable to them. So What am I trying to drive at? From research,
Okay.
we translate it into practice.
Okay.
Into practice. And practice is healthcare improvement, regardless of the cost.
Yeah.
Yes, so it is improving the hospital in one way or another.
On the other.
Yes.
Have you encountered some challenges when it comes to the communication with the patients who are giving you the information?
Yes, of course we can. Of course there are challenges everywhere.
They'll have
Just
to be
know
that.
wherever there's a good thing, we have to look out for a bad thing. And doesn't mean research is as smooth that when we go out to collect the data, it is.
Yeah.
So we have challenges. Some patients actually tell us wrong information. Yes, but it is natural. So some people protect themselves, which is natural. So I actually, in the same line, I really want to add patients. Open up to this doctor, this healthcare provider. It is something important, because in the event that you don't tell them the truth, they might actually give you a wrong drug, because they'll make a wrong diagnosis. Let me give a classical example. A pregnant mother comes to hospital maybe in the early stages of pregnancy, maybe 12 weeks, 13 weeks. They know they are pregnant and they don't disclose this information to a doctor. There are some drugs which are actually contraindicated in pregnancy. So the doctor might end up giving this drug which is going to affect the fetus. And at the end of the day, the doctor will be at fault, the mother will be at fault, and we shall lose this baby. So it is very important for our viewers, this is a take-home message, to give extremely accurate information. And patients should know the information they give us, we keep it as confidential and private to our extreme best.
Maybe they think you would display this to any other person.
No. Actually, we as health workers, from our profession, the oath we sign, we try to, actually, because of this oath, it protects the patient. We should do absolute no harm to the patient. Doing harm, one of the ways we do harm to patients, if we disclose their information. Because for us to disclose that information, we need to seek consent from this person, that, you know what, we want to disclose your situation to maybe your family members. Do you give us a go ahead? Yes or no? If they say no, we keep it to ourselves. That is why our systems are extremely protected. Yes.
So you mean that the patient has the right to, whatever the patient tells you is what you adhere to?
Yes.
So what if the relatives want to find out what's really disturbing the patient now? Is it, I thought also the doctors, people who are in charge, have the audacity to really share with these people?
No. That's not how it works. The patient has every right to their information.
Okay.
Patients have to consent for you to tell the caretaker. That is why, even when you come to hospital as an adult, we ask you, do you need a caretaker by your side as you're sharing this information? When you say yes, that is informed, that is actually an implied consent, that it is okay for this caretaker of mine to be in presence when you're taking the examination, when I'm taking the history. So it is not okay for me to just share the patient's information to the relative. That is against the medical ethics.
Okay.
Yes.
Now that we can ask a question that, so what if, for example, God forbid, a patient dies, so do you still keep this information confidential, or you again share with the relatives, or it's kind of different?
So what we do, when the patient comes, there is what they call the third party. This third party can be their closest relative.
Closest relatives, okay.
Yes, of course we find some challenges. There are people who come in with different people and you can't know who the closest person is. But usually if this person is a married person, or it is maybe their first degree relative, or maybe their brothers, these are the people actually we actually get in touch with. And we do not share that extreme data about the patient if in the earlier instance they sign that they didn't actually consent to us giving information to this person. What we can share is, maybe if this person maybe died, we shall tell them the cause of death. But this yes, the cause of death, because at the end of the day they'll go home with a death notification, a death certificate, and that is all actually we can share. That is it.
That's how it is done.
Yes, that is it. Because sometimes the kind of information you share with the relatives, some may take it in good faith,
Others in the bad faith.
others may in the bad faith, others may dispute. So there are a lot of challenges surrounding that issue.
So have you gotten some cases in line with that as Mengo Hospital? Or initially I've never experienced any?
Yeah. Yeah.
And you can give us a scenario when that happened maybe.
Yes. We have this patient, an elderly person. Probably they've made some quality amount of money, a huge amount of money. So this person was critically ill. They are aging. They had different chronic illnesses, and this person dies. This person did have only one woman.
Oh.
Yes.
Okay.
So you see such challenges. Now, you as a health worker, you have to ask yourself, who do I give this important information to?
Yes.
It's quite tricky.
Okay.
And so many institutions actually facing the same challenges. And we need to be very, very careful when we are sharing this information. That is why we do not give this information right away. We wait for the family to settle, and then they'll come for family. We call it a family conference of the deceased, and we see how we can actually disseminate this information to the right person.
Okay.
Yes.
All right. We are still having a beautiful conversation with Dr. Ronald from the Department of the Public Health and Research at Mengo Hospital, and we're looking at why research matters and how hospitals turn questions into the better care. With your host Ritah Nandera. Allow us to get into a quick commercial break. We'll come back with more of the conversation. Stay tuned to the coffee break.
This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission.
Welcome back. Now it is an eye-opener to all the viewers out there who always go to the hospitals and you don't want to really give the information to the doctors about whatever you are going through to prevent the circumstances and whatever could be happening. So you are requested to kindly be opening up to yourself to the people who are responsible to see that whatever disease you are experiencing, you get the right medication. So right about now, we want to find out how does the information of patients contribute to the improving healthcare and guiding research.
Yes, thank you very much. Yeah, good to be back.
Okay.
I'll say the questions actually we get from patients actually define what we are going to use the question for, and then we design the solutions to improve care. So in this case, every information the patient gives us, we deem it accurate, and we try to probe as much as we can so that we see how much is affecting this person. Some are related to the disease, others may be related to their mental health. For instance, if a child came in with recurrent illnesses, we are interested in knowing how are they sleeping, how are they at home. We want to probe as much as we can to get information, so that sometimes actually we find ourselves managing the social well-being before actually even we manage the illness.
Okay.
So we explain to people about these preventable measures, preventable maybe risk factors that actually shape the quality of care at the end of the day. So when you're managing our patients, it is holistic. This is why actually we take all this information. So collectively, if we think maybe children are eating a certain set of food, it gives them maybe diarrhea, or there's a given way they behave after eating some food. At the end of the day, we shall communicate to the public. We shall actually get as much information as possible, draw findings, then we disseminate these findings to the community. Tell them, you know what, this kind of food predisposes these babies to this. So that is how actually this information is helping the patient. That is how it is helping not only us, the community of Mengo Hospital, but the community at large, the Ruga Division, Kampala, and eventually it can go to disseminate across maybe the nation. Yes.
Great. And let's look at the part of protecting the patient privacy and its consent and needed before using the patient's data for research. I think give us more the highlights about that.
You know, as a hospital or as healthcare providers, we sign an oath to keep patients' information private and confidential. That is why we try as much as we can to talk to you in private. Yes, so that talking to you in private implies that whatever you're telling us is safe with us. And we urge patients, the viewers, to tell the health workers as much as you can related to your illness. Maybe from the information you give, we are going to design what possible solution, either in terms of medicine, in terms of advice. At the end of the day, we're trying to improve your care as a patient. Yes. How do we keep them confidential? Since we have a rule governing us, we have laws governing us of privacy, we have to make sure we do not at any one time release information about a given person to anyone, unless this person has given us consent. In health, in hospitals, how do patients give us consent? When you come to me as a sick patient, we shall have a discussion. I'll create rapport. Rapport is this making you comfortable so that you can give me this information. At the end of the day, if you need to go to the lab, I'll advise you about going to the lab, and I'll ask you if you have maybe the funds to go and do the lab investigations. If you say so, that is implied consent that you have accepted to do what? To do the lab. So that is implied consent. When it comes to research in an actual design study, we have consent papers. This consent form, we read to you what we want to do. We teach you, we educate you about what we want to do and how it is going to benefit you. And in what way it is going to affect you and what impact this will have. For instance, if I'm going to do a study and I'm going to pick blood from you, I'll have to explain to you that, you know what, I'm going to pick some blood from you. The injection is what? Might be painful. Every injection, a prick is you trying to, as much as it may not be grievous harm of pain, but there's some pain. So having explained to you, you'll accept. And this is not coerced, it's not coercion. You have actually all the right to voluntarily withdraw from the research, to accept, and without any harm. We as the people who are collecting the data, you don't, what can I say, it's not a forced action that, you know what, if you don't engage in this research, we shall do this will happen to you. No, it is voluntary. So a patient has a right to participate in a research. Yes.
Has Mengo Hospital, as from your side, have you carried out sensitization to give this information to the patients, only to the communities, about their confidentiality when it comes to having communications with the doctors wherever they go for the medication? Because I think when they're not aware about this, it also hinders maybe and they are given the wrong treatment for the wrong disease. And Mengo Hospital, how far have you tried to reach to the people in this nation maybe?
Now, first within our community, we have a public health department.
Okay.
Now, this public health department has different can I call them like units? One of the units is called a community-based unit.
Okay.
Yeah, they go out there to educate people about different illnesses.
Yeah.
About their participation in improving quality care, in improving care, and so what I'm trying to communicate is we have different programs that try to educate these people out there in the community.
Yeah.
So it is an ongoing process. So it keeps every week. Every week someone is out there giving information to these patients. Why are we giving information? To make sure people make informed decisions. Yes. We want to base everything on evidence.
Yeah.
So if we give people the right information, when they come to us, it will be because we are giving them the right information. The people are not giving them, they're not misinformed probably from their small circles. So we try as much as we can to give this information to the patient.
Yes, Doctor, you mentioned about also in the conversation, you say that some patients give inaccurate information. How do you tell?
How do we tell?
How do you tell that this information is wrong? Or maybe you, after maybe hearing from other patients, how you conclude? Or it's kind of different?
You know the surprising thing about patients, not only patients, including myself, including you, when you're going through a series of so many events, maybe challenges, some you may actually withhold.
Yeah.
You may not actually tell the whole part of the story.
Sure.
Or sometimes to benefit or to make yourself comfortable, you might actually choose to tell the doctor the wrong information. Yes. So we encountered a scenario of a house help. That was around 8 years ago.
8 years ago, okay.
This lady comes in with abdominal pain, they're putting on a jumper. They're not telling the doctor that actually they are pregnant. The doctor tries their best to examine them, but they object. So at the end of the day, we're like, let us give her time. Let us find someone to talk to her. This was a house help. When this person runs to the toilet, we hear a bit of screaming. We're like, no, there's something. So this doctor comes like, this patient is actually withholding information from us. Little did we know, this person was pregnant and they didn't want the whole community to know that actually they were pregnant. Yeah, so we had to evacuate this patient, took her to the right department. They had come actually to the outpatient department and we found a way of helping her. Guess what? It was labor.
I can't imagine.
Yes.
Wow.
So we had to counsel the patient themselves. We helped her through the whole process. Then we had also to, because this person had been brought by their boss, their home boss, that was the mother of the home. So we had to talk her through the whole, counseled her, and eventually actually got a social worker to try to cross-examine what was happening and why this person was fearful to give information to the health worker.
Maybe they were going through certain things.
Yes, so the health worker eventually found out and actually they forged a solution for this person. Yes. So that is sometimes patients give wrong information. The other way is this person this time they'll say this, but remember they'll come back for what? For another service, and maybe they'll speak otherwise. So at the end of the day, what we're trying to urge patients, please give the right and accurate information to the health workers. This information is safe with us. Yes.
For the time being, you have been in the field, and over how many years you have been in this field of research?
5
years.
5 years.
Apart from Mengo Hospital, have you tried to get some information from other maybe hospitals which have encountered some challenges whereby patients' data, private data is disseminated or can I say hanged, and also maybe people get to know about certain information which is needed to be kept private by themselves. And what causes that also maybe?
There is an advert on the radio, even sometimes on the TV, where someone says, "Oh, why? I've seen your name and there's this information on this paper, about this person's HIV results and whatever is happening. No, there's when I keep listening to that advert. I don't know it very well, but the nation also has come up to see how this data is protected. Yes, it can happen. Remember, some information is written.
It's rated, yes.
Some is printed. Even these, the papers I'm giving to this patient, sometimes they may not know how to keep them safe or safeguard them. Eventually, the same papers might end up at a Sumbusa shop and they're trying to make those Sumbusa packages. It could leak. It could leak. And so the government is trying its best to try to counter that. Yes. So at the end of the day, patients' information leaks, maybe they get to know about them, and the way the community views them changes. So you know what, that whole cascade where this one knows about your illness, you get stigma. There are a lot of things that happen. Yes, that is why it is important to safeguard patients' information.
Okay.
Yes.
As we're coming to an end, what is your final message and to the community and other health facilities about the importance of research? Maybe they need to get to know about this.
To the community, but let me start from the individual. To the individuals, they should know that the information they give us is actually very, very important in actually improving their care. To get this quality of care, to get new machines, new innovations, new methods of actually caring for patients, it is because of their accurate information. So I urge every person coming to seek medical attention, medical assistance, they should give the right and truthful information. Yes, to make sure that actually they also help us. Then to the healthcare providers, research is not a one-time thing that I'm going to do it and go. Somehow it is integrated in our everyday practice. So I urge institutions to actually empower their research departments, because collectively from different institutions, not only Mengo Hospital but also the rest of the facilities, healthcare providers, we want to use this information to make lives better for our different clients and different communities and populations. Maybe there's this bit I've been forgetting. There's a role in collaboration. The reason as to why the government is trying to pick as much information from it is because they try to partner with different people. It is also good to collaborate. Mengo Hospital can collaborate with Makerere University, with maybe joint medical research, maybe Medical Research Council, other sister institutions. We have Chisubi, Zambia, Rubaga, Mulago. At the end of the day, we're working as a team to see that actually we improve services to the population. Yes.
Someone asked themselves a question: Is it how costly is it when it comes to the research being carried out? Or it differs?
Of course, it differs. Research that includes vaccine manufacture, getting a new drug, a new antibiotic, it is quite lengthy. Coming up with a new modality, it's quite lengthy. That innovation sometimes is quite costly. You need to invest enough.
A lot.
But it doesn't mean that every research is costly. Imagine if I collect data from this, if I came to your office, this office, and I took blood pressures every day for the next 2 months, I'll be in position to tell how your pressure changes every day. And maybe from that document, that information, that data set I've collected from here, I can come up with findings which I'll communicate to maybe to your head of department about how you people are in terms of blood pressure measurements. So sometimes it is as simple as that, and sometimes so it varies.
It varies.
Yes.
All right, allow us to end from here. That has been Dr. Ronald Kasoma Mutebi from the Department of the Public Health and Research and Mengo Hospital, and we're unpacking why research matters and how hospitals turn questions into better care, and that is the way to go. You have heard from him, and the way is to adhere to what the doctor tells us to do, and if you really want to see that your life is becoming better and becomes more better and better. Allow us to wish you a blessed Tuesday. My name is Ritah Nandera. Next we're having the lunchtime request and so many other programs coming on board to be that you are enjoying, and we wish you well. Bye-bye.
Thank you.
This is Church of Uganda Family